a lot of kids, even kids, teenagers, adults, elderly. Used to be it's only elderly patients having diabetes. Now it's even kids and even younger generation.
So when you have luka yang sangat very long time for you to heal, that is also another symptoms of diabetes.
But yes, there is patient who has normal HbA1c,
Yes.
normal glucose, but their wound takes a very long
Correct,
time.
correct. That is already considered you're heading towards there lah. Most of the time, because why? Bacteria suka gula. Bacteria loves sugar. So any kind of infection, we will always advise the patient to reduce your sugar intake.
Yes.
But that is another early sign. Morning, diorang ambil oatmeal.
Yes,
They say, oh,
oatmeal
okay.
is very popular.
Oh, okay, I nak kurangkan gula. Pagi-pagi makan oatmeal. Oatmeal is another...
Like
it's
mostly
not
you have gestational diabetes. After sometimes it does go
Yes,
off after
yes.
your pregnancy, but it comes back as a type 2 diabetes.
Correct.
Yes.
So these are the three main diabetes lah that we always
Okay.
will see.
So the most common one right now is type 2.
Type 2, yeah.
You can eat rice, but eat in moderation. Boleh je makan nasi.
Highly encourage anyone to start on ACV, apple cider vinegar.
Selamat Doctors, ini Dr. Diabetes. Hari ini dalam Health Talks, kita akan bersama dengan Dr. Nithya. Okay, hari ini Dr. Nithya, dia akan menjelaskan mengenai kencing manis.
I'm a medical doctor for the last 10 years. I have my own clinic, Polyclinic NMV in Kota Bayu, Emas, Klang.
Okay.
I'm also a certified lactation counsellor. I'm a certified occupational health doctor. I'm also a certified diabetic counsellor.
Okay, so you have so many certificates.
Yeah.
Interesting. I would like to know more about the lactation.
Sure.
But Doctor, today our topic will be more on diabetes. Okay, so if about more on diabetes, because nowadays a lot of kids, even kids, teenagers, adults, elderly. Used to be it's only elderly patients having diabetes. Now it's even kids and even younger generation.
adults, yeah.
So doctor, can you explain or not the types of diabetes first? So we'll talk about the types of diabetes, then we will go to further details of it.
Okay, before we start, diabetes itself, it's like macam kata-kata haram already.
Yes.
Diabetes is everyone's like a little bit scared. Alamak, diabetes like that. So diabetes, if you compare in Malaysia is the topmost country in Southeast Asia with the total amount of diabetic patient as the highest total amount of diabetes patient actually.
Oh,
Yeah,
this one
they have the most. Even in, I think recently there was also, you can see in a lot of TikToks also, they came out with an article that Malaysia is the fattest country in Southeast Asia.
Second,
No,
actually.
first is first, yeah. With the lowest is Vietnam. If you notice, they did that comparison.
We did have a pediatric surgeon in our podcast before, so he did say about that.
Yeah.
Malaysia is very healthy. Sehat sangat.
Itulah. And it also works the same for diabetes. In Southeast Asia, Malaysia is number 1
Wow.
with the highest prevalency of diabetes, and in Asia number 4. So it's considered quite a crucial thing
Johan lah.
Yeah, betul. And diabetes is the single most health epidemic, I would say, globally.
Okay.
Anywhere also with
Yes.
diabetic. That was it. Diabetic is what we call as a metabolic syndrome.
True.
Kenapa? Sebab metabolism you turun. Kenapa metabolism you turun? Satu, age factor. Another one can be insulin resistance. All these things we will speak later lah.
Yes.
But diabetes, generally, there's 3 types.
Yes.
Type 1, it's an autoimmune disease. That is because the cells in your pancreas is failing.
Yes.
So that one you can't do much. Usually it occurs, it starts when you are a child, children, young adult. Later on in age also, it is possible for you to get type 1 diabetes. Tapi very rare lah. Most of the time it's
Most
children.
of the time, younger children we already know. Okay,
Yeah.
something is wrong. Then when you check, you already know, oh, type 1 diabetes.
Correct. That is
Yes.
because your pancreas is failing.
Yes.
Type 2 is what we call as a lifestyle disease,
With a lot of people having that issue right now.
Yeah. So
Okay.
type 2 diabetes is because of your insulin resistance in your body. Why? Because of your lifestyle, your eating pattern. Genetics, if you ask me, right, I would say probably just a 40% lah. Mainly it's just your lifestyle.
But I think it is something that everyone uses it, right?
Yeah,
I have
yeah.
patients like 17, 18 years old. They are diabetic. When they come in, they are already diabetic, diagnosed diabetic. They come in for a checkup, and I'll be like asking, what happened? How come you are getting? How come you're diagnosed? And all they'll be like, saya punya ayah, doctor.
Genetic. They always blame the genetic.
Always the genetic part, but actually it really doesn't.
It does.
it-
Genetic
like
does
less
play a
like-
role. Yeah, but very, very minimal. Practically it's just your lifestyle.
Yes.
It's your lifestyle.
The lifestyle
Walaupun genetic, kalau lifestyle kita betul, we can control it.
Yes,
we can still
true.
avoid it. And the third most common one is gestational diabetic. Happens when you're pregnant lah.
Yes.
Itu that one memang you cannot blame anything. You cannot blame lifestyle. You cannot blame your pancreas.
happens lah.
Yeah, it's because of your hormones lah.
Yes.
Hormones, because of your hormonal changes, causes insulin resistance. Ideally, it will go off. But I've seen patient yang ada genetic gestational diabetes, right, will eventually turn into type 2 diabetes either.
Yes,
It
but
is possible.
it's usually like that, Doctor. Like mostly you have gestational diabetes. After sometimes it does go
Yes,
off after
yes.
your pregnancy, but it comes back as a type 2 diabetes.
Correct.
Yes.
So these are the three main diabetes lah that we always will see.
So the most common one right now is type 2.
Type 2, yeah.
Okay,
yeah.
type 2. So if like type 2, what are the most common symptoms do we see?
Okay. Most early symptoms, what we call as early symptoms, is three things.
Yes.
First thing is you feel very thirsty.
Yes.
Polydipsia, and then you will feel you want to urinate a lot, and then you want to eat a lot. You will have these three, which is the most common symptoms that people know. But before we go into all this, that is what I would usually call as an early sign. Meaning your HbA1c will be normal, your glucose will be normal, but you will have this thing where you makan berapa banyak pun, you still will feel hungry. You will have that craving. You know, you feel like tak cukup nak makan and all this. This is one of what I would call as a super early sign. Okay. When you start having this kind of symptoms, you think like, I baru makan. Then you'll have this feeling that you want to have dessert. You'll have cravings for, you know what we call a sweet tooth, right? You'll have cravings for this one. So when you want to have a dessert or you want to have a snack after you just have a hearty meal, that is already the earliest sign of diabetic. Not many people actually know about it. They always wait until like, kenapa saya banyak kencing, kenapa saya banyak minum, all haus and all this, the common ones, this. I have also seen patients that they don't have any other symptoms, but the wound will take, like they will have like probably terhantuk mana-mana lah, their kaki or what, they will have wound, luka. Will take a very long time for them to heal.
Okay.
When a patient like that comes, the first thing you should check is actually sugar.
Yes.
So when you have luka yang sangat very long time for you to heal, that is also another symptoms of diabetic.
But yes, there is patient who has normal HbA1c,
Yes.
normal glucose, but their wound takes a very long time.
Correct. That is already considered you're heading towards there lah. Most of the time, because why? Bacteria suka gula. Bacteria loves sugar. So any kind of infection, we will always advise the patient to reduce your sugar intake.
Yes.
But that is another early sign, early sign, super early sign.
Yeah.
Maybe not in 1 year time, maybe another 5 years time, or maybe in another 6-7 years time.
Okay.
Yeah. So this is a symptoms where a lot of people doesn't know. They just feel like they just blame stress. Oh, I'm a stress eater, so I ate it because of I'm just stressed. Because of hormones and all that. When you have a strong genetics, meaning like genetics, your lifestyle factors, and you have this thing where you just crave for food all the time, you're heading towards diabetes.
Okay. Actually, that is a new information. Because most of the time we do say that we do have stress eaters. We do have hormonal eaters. It's especially women.
Yeah.
When they are having their ovulation or they're having
Correct.
the way they eat, it's like
Yes,
it's
correct.
like something else.
Yeah.
Even it happens to me.
For women, it's different because if you compare women and men, right? Men goes on a 24-hour cycle, meaning every morning they wake up, their hormone is at the peak, their energy is at the peak, everything is there.
Lucky people.
Yeah. Women, we have a 28-day cycle.
Yes.
So not every day is the same for us. So if we compare male and female has more, you have the numbers where female is the one who actually has more diabetic compared to male. And female are the one who has tendency to easier get diabetic compared to the male.
Is there a
hormone?
factor?
Yeah, I mean hormones lah.
hormones,
Hormones like I said, because of the cycle, energy cycles and all that, which will eventually cause insulin resistance.
Okay. So like for insulin resistance, we do have symptoms, early symptoms like keratosis.
Yes.
So any other symptoms, doctor?
Main usually I would say these are the main ones which will always see. Practically you see, right, type 1 diabetic and type 2 diabetic. Type 1 diabetes is because the cells in your pancreas is not working.
Yes.
That is why you get type 1. Type 2 is a lifestyle diabetes. Why? Because of insulin resistance. What happened is that the insulin resistance actually starts from your liver. Function liver tu untuk detox.
Betul.
But when you have diabetic, your liver is like penuh, tengah full. It's full of all the fats and all these things, fatty acids and all that thing. So therefore, it's unable to process the insulin faster. So I would say what do you feel is that you feel tired, fatigue, all the symptoms lah, basic fatigue, and then symptoms from the physical wise, usually keratosis. They will have darkening of the neck. They have darkening of the fingernails, skin, because you tak boleh detox. detox. When you cannot detox from your body, you will have all the symptoms. This thing, skin tags. Some of them will have like small tin tags on the face, on the neck.
Very common.
Yeah. All these are like very common. So when you want to think symptoms of diabetes, think of detox. When you cannot detox, what will happen? Some of them even come with constipation. All these are like what you look at the root cause of it lah.
Okay. Interesting. So it's like, so insulin resistant we do when a patient comes in. So we notice all the symptoms. So when we notice all the symptoms, we do suggest patients, like, I think, okay, you are already in the stage of insulin resistance. So if it's going to go like this, chances of you getting diabetes is very high. So we do tell them, okay, you have to do weight training. You have to control your sugar. You have to reduce your carbs. Increase your protein intake. So anything else we can tell them.
Okay, so people who, if someone come and tell you lah, diabetes, oh tak boleh reverse. You kena makan metformin sepanjang hidup. You tak boleh sentuh nasi. You tak boleh makan nasi lemak. Matilah you kan.
Mana
cannot.
Yang Malaysian.
They get very frustrated, very restrictive.
Yes.
And then they get down, and then they rasa tak apalah, buat apa saya nak control sugar. I rather do this. So I will always tell my patients that, like I say, there are two types, type 1 and type 2. Type 1 memang, I'm sorry, I cannot help you because it's your cells, you know.
Yes.
That one we really cannot help you. But type 2, nak kata sembuh tak? I tak janji you akan sembuh, but I can help you to reverse it. I can just help you to reverse it. Okay. You want to do it or not, it's up to you. Kan?
True.
So
it
basic, yes. So 5 perkara ni je. I always tell my patients, you wanna reverse it, very easy. Buat 5 perkara ni saja. Number 1, add more protein to your meal. Eat more protein. More protein, like eggs, chicken breast, any kind of proteins, add it to your meals. Why? Because protein will take a slower time to convert into sugar. Therefore, it won't increase your insulin spike.
Yes. And also you feel very much fuller.
Yes. And this is one thing that I used to tell my patients lah. Kalau you are confused what to eat and what to eat kan, senang je, very easy. You ada 2 makanan, okay, kat depan you kan. Satu makanan, you tengok yang mana ciptaan Tuhan. I actually saw it in one of the videos. I don't remember by who. So, kalau makanan ini ciptaan Tuhan, makanan satu lagi ni ciptaan manusia. Makan yang ciptaan Tuhan punya. Ciptaan manusia punya jangan. So, makanan ciptaan manusia, yes, processed food. Hot dog, nugget, susu pun, fresh milk, ciptaan Tuhan. Susu cair, susu pekat, ciptaan manusia. Okay, put it away. When you're confused whether you can eat or not, use this concept.
So
whole foods.
Yes,
when you tell them eat whole foods, some of them they are not so sure. Whole foods tu apa, what to eat. So in this way, you won't be confused at all.
Yeah, it gives them an idea actually.
Yeah.
Okay, ni saya boleh makan. Ni tak boleh makan.
So increase whole foods. Whole foods macam mana? Protein, vegetables, legumes and whole grains lah. So not to say tak boleh makan nasi langsung, tak. It's legumes, it's whole grains. You can still eat. But anything also, moderation is the key.
Yes.
Jangan sampai, doktor kata boleh makan nasi. Palau lah 2-3 nasi. Tak boleh lah. Kan? Anything.
Yes. I think sometimes it's like, some patients do come and complain, saya tak makan nasi langsung. Saya stress. But actually, I do tell them, if you do not have to go to that extreme. You can eat rice in a certain moderation,
Yes.
Because if you don't eat rice, you become very down.
I had this one patient when I was working in Jerantut lah, in Klinik Kesihatan Jerantut. This auntie, she come in with something what you said. She was like very stressed. That time I was a diabetic counselor, right? So we have our sessions lah. She came in, she was very stressed. She was like, doktor, saya dah kontrol makan, saya tak makan nasi. Tapi kenapa gula saya tak turun kan? I said, okay auntie makan apa breakfast? Oh, saya minum teh O. Tak pakai gula, tak pakai susu, nothing. Okay? Dengan 12 cream cracker.
Mati dah nak.
Adik, apa 12 cream cracker? I say 6 cream cracker is equivalent to 1 cup of rice.
What? Yes,
might as well
eat the rice.
Might as well makan nasi lemak. Nasi lemak ada carbohydrate, ada protein, ada fiber kan? Lagi complete. So a lot of wrong misconception.
Yes.
So people always think rice is the enemy. Rice is not the enemy. You are the enemy. You are always picking it the wrong way to eat, you see?
True.
Yeah. So all this will contribute to it. I still remember the patient because it was like a very unique case lah.
Yes.
So a lot of misconception. People tend to get for, okay, another one more thing people tend to do is that morning they orang ambil oatmeal.
Yes.
They say, oh,
Oatmeal
okay.
is very popular. Very popular.
They say, oh, okay, I nak kurangkan gula. Pagi-pagi makan oatmeal. Oatmeal is another, it's not a complex carbs. I wouldn't say complex carbs as rice, but it does has a high consistency of carbohydrates. Of course,
Yes.
fiber is there, but I wouldn't advise it. If you berani, if you confident kan, puasa dulu pagi. Do IF. IF is an amazing way for you to reverse your diabetes.
Yes, it does reduce your insulin resistance.
Yes,
as well.
yes. It lowers your insulin spike. Therefore, it clears off your liver. There, in that way, what it does is that it reverses back your type 2 lah. That is number 3 what I tell them.
Okay.
Fasting, long fasting. So IF actually helps. Number 4, strength training. Atau exercise, of course lah. Ini memang anywhere also. What happen? When you start strength training, when you start to exercise, the sugar in your body get converted, because muscle uses sugar, right?
Yes.
To retain it. So it pulls out all the sugar in your body. So 80% of all the sugars in your body goes into building your muscle. So that way you lower down your HbA1c. You can reverse it back in reversing your insulin resistance lah.
Yes.
And one more thing, the most common, most important thing is to add fiber. What do we do is, kita selalu macam kita start straight nak makan, right? What we do is that we always go for rice first.
Yes.
Terus makan nasi dulu, semua dulu, and then fiber is always the last choice. Even vegetables you see, vegetables, fresh vegetables, we stir fry, kita goreng kan, automatically it become carbs. It's no longer fiber anymore. The reason why we are taking vegetables is because we want that fiber, right? So try to take it as fresh as possible.
Okay.
In that way, when you do it that way, end up is that you can lower your sugar spike, your insulin spike, and then you lower your insulin resistance. So in a way, you can reverse type 2 diabetes.
Okay. So, doctor, before that, the fiber part. So, is because there is so many times that we have heard you are supposed to eat it half an hour before, we're supposed to eat it 1 hour before. So, which one is the truth?
Okay, if you tell me, nak kata you want to have like half an hour before, and then 1 hour before, and then 1 hour after. To be honest lah, when we are working like this, right, we want to get that 1 hour of lunch break pun kira luxury already.
True.
Yeah, I always tell people, you accommodate to your lifestyle. Not necessarily you must have it way earlier. Take fiber first every time when you're eating, and then protein, and then carbs. There is no certain timing you must take way ahead, no.
Okay.
You
So,
can
it
always
really
take it
depends
later.
on you lah.
Yeah, correct.
But the arrangement, the order will be like fiber first.
Fiber, protein, carbs. Carbs always the last.
Okay, so it reduces your
Insulin spike. Yes.
Insulin spike, which reduces your insulin resistance.
Correct.
In the end.
And you can also notice a lot of difference from your stomach. You will have better digestion. You won't have bloating. You won't have that nausea feeling and all that. It
Yes.
gets your gastric better as well.
Okay. So, doctor, to recap, what are the 5 steps again?
Okay, so number 1, I would say increase your protein. Number 2, include more whole meal into your food lah. Number 3 is to add fiber. Number 4 is strength training. Number 5, water. Most important thing, water. Lupa pula. Air. Every 25 kilogram of berat badan, you need 1 liter of water.
Okay.
So if you're 50 kilos, you need minimum 2 liter. So you just tambah-tambah je lah macam tu. And minimum requirement is 3 liters of water. When your body is dehydrated, your organs cannot work properly. So when your organs can't work properly, it will lead to all this complication.
Yes. Okay. So the water part that we have a lot of difficulties because we don't drink water.
Yeah.
We really don't drink water.
And water is water, we don't consider coffee as water. We don't consider your syrup as water.
When you say this, I remember there was one patient. Okay, puan minum berapa air sehari? Saya minum 2 liter, doktor. Okay. Tapi saya minum 4 cup coffee.
See? Caffeine is dehydrating agent, you know.
It's like 250. It's like 1 liter. 1 liter of her daily intake is
It's 4 cups of coffee.
4 cups of coffee.
So, see all this misconception. So all this actually nak katakan, right, our generation, our kind of generations, they're actually very well versed. Bukan nak kata ignorant. They do know. They are very well versed. They know the knowledge and everything. I wouldn't say they're ignorant or they don't know. The thing is that they just, one thing, the most common they'll say, tak ada masa, tak ada waktu, you know, they are too busy, they're too tired. You can make the effort. The knowledge is there. Even when I tell to the patients, right, bukannya diorang tak tahu, diorang tahu je. Ya, doktor, saya tahu. Ya, saya kena buat macam ni. They do know all this.
They're quite smart. Actually.
Yeah. They don't take the effort.
Yes, they know what to do, how to do. It's just that they don't take the effort. Like
Correct. My clinic, same row with a nasi kandar shop.
Okay.
So before I open at 8 a.m, before I open, usually I park my car in front and then, you know, I'll go open the shutters and all that. Kan? So at the nasi kandar, pagi-pagi at 7 a.m, 7:30 a.m, I can see a lot of families. Family banyak-banyak tau, a lot of families. And they'll be eating with kids. probably like 5 years old, 6 years old, and they'll be eating like roti canai, they'll be eating like mee goreng and all this thing since a very young age. Okay, I understand you're a working mother. You tak ada waktu nak cook at home. You just want something fast, something quick. You quickly eat and then you go and send them to kids to school or daycare or something like that. But can you imagine what will happen in another 10, 15 years time? During our parents' time, 40 years old is considered too young to have a diabetes.
Yes.
They say, oh, alamak, muda-muda dah dapat.
Betul.
Right now, we are seeing people in 20s.
18.
Ah,
I think my earliest patient was 18 years old. And I think one of my patients, she was like 23, but she was ESRF patient.
Are you?
Yes, ESRF patient, and she's already on dialysis for the past 3 years.
See?
So it was really sad, and I really thought it was something that she was born with or something. But when I was trying to get more information, she was diagnosed with type 2 diabetes when she was 16. Then it went on, and then she's now doing dialysis.
See, that's why. So even kids, you can just drive through kat McD. It's fast, it's easy, you get it fast. Kids like it. You can see a lot of kids in the morning, McDonald's, KFC, roti canai at a very young age. When as a parents, what you're supposed to do is that we're supposed to introduce more whole foods to them, right? Of course lah, kita kata boiled egg lah, buat breakfast lah. But why don't you spend at least half an hour in the morning, to prepare a hearty meal? Not only it's economical, lagi murah, but it's also you have the satisfaction that you are giving your kids a better breakfast in the morning. Breakfast is the main important food in the morning actually.
What would you suggest of this? Most simplest
Boiled
breakfast.
eggs. Tu je. Most of the time I tell them kids, if you don't know what to do, just boil 2 eggs, give 1 banana, settle. Berapa banyak je budak-budak
so
nak makan
fiber
kan?
and protein and stuff.
Yeah. You have banana as a source of potassium and also for carbohydrates, so you keep full longer. You have your boiled egg as your protein. So that is a perfect breakfast actually.
Okay. It's quite simple actually.
Yeah. It's easily accessible.
Simple.
It's simple. But the thing is that healthy foods are expensive.
Yes.
We can't deny that.
Yes,
Yeah.
it is. It is much cheaper to eat.
Yeah, unhealthy food.
Unhealthy food.
McDonald's $5.99. Dapat burger dengan air sekali.
Yes.
This one, you see so much of hassle in the morning.
That's true. Okay, doctor. So if we are going to look at this, how would you actually diagnose a patient? Macam mana nak cakap patient ni memang ada kencing manis?
A patient coming with all the symptoms. Main 3 things lah. Main 3 yang kita akan buat.
Yang air, cepat dahaga, cepat
any kind of symptoms lah. They come in.
Makan.
Okay, how do we diagnose a patient with diabetes? Okay, kita tahu you diabetic, we will do 3 main things lah. First thing is fasting glucose, glucose sugar. And there is also a lot of misconception. Of course, we will kata maximum 8. I mean, you have to puasa for 8 hours. A lot of them, they come in, a lot of them doesn't know also. They will say, oh, saya berpuasa lagi lama, so my fasting sugar will be lesser. Actually, no.
Yes.
No, it doesn't work that way. Yeah.
Yes,
what happens is that when your body, this is what we call as autophagy, meaning your body go into fasting mode for a very long time. Body start to produce your own insulin. Body start to produce your own sugar from the liver. So what happened? You have an insulin spike there. So it will be incorrect as well. Probably the sensitivity of it will be very much less. Gold standard is always HbA1c.
Yes.
HbA1c is gula purata dalam darah for the last 3 months.
Yes.
So
this is how I will always tell my patient. Okay, yang ni, okay, gula dalam darah dalam 3 bulan lepas.
Yes.
Okay.
Dalam sel dalam merah. Tak boleh tipu.
So make sure that because most of the time their fasting blood sugar will be less.
Yes.
The HbA1c will be very high.
Correct.
So, and then they will be like, saya puasa doktor. Saya puasa 13 jam.
Macam mana ini boleh kurang, ini boleh tinggi?
Yang ni 3 bulan lepas.
Yes.
Dalam sel dalam
That's why I say for HbA1c you tak puasa pun tak apa.
Actually.
Because it will be there. And then the third one is of course minum air gula lah. The most of the pregnant women's dread one lah.
I've heard my patient say.
Yes.
Doktor terlalu manis lah.
You cannot. You feel like you want to vomit and then you will be hungry.
Terlalu manis. Tak boleh.
Now got perisa.
Yes. Recently I saw.
Yeah. So the perisa one is a little bit better. So comparatively, of course, the gold standard will be HbA1c. Yeah, HbA1c is the gold standard where we diagnose.
So with the value of HbA1c, what would you say it is? Kencing manis.
Okay, so
because
HbA1c,
we have diabetes,
pre-diabetes, yeah.
Yes.
Less than 5.7 is normal. 5.7 to 6.2 is pre-diabetic. More than 6.2 is already diabetes. Pre-diabetes patient, right? When you are in pre-diabetes 5.7 to 6.2, I always tell them, jangan bagi dia ke situ. Kita nak tarik balik. So when we want to tarik balik, I will encourage to do the same thing as what I will tell my diabetic patient juga, whatever I just told you lah.
Yes.
And I will always give them 3 months time. Why? For you to make a habit, for you to actually make it a habit will take 21 days, any kind of changes. And for you to make a lifestyle, it will be 90 days.
Yes.
So anything also 3 months. Once 3 months, whatever that happens in 3 months time, even if I want to start a patient on a medication together with lifestyle modification, right, I would say 3 months, come back and repeat. So by the time that 3 months, it's already a lifestyle for you. And once the numbers are beautiful, you don't feel like you are actually putting in effort to make the changes, you see.
So, okay, so now we have said how will we diagnose the patient. So like what doctor said lah, is mostly we will go for HbA1c. So from HbA1c we will see if you're pre-diabetes or diabetes. So pre-diabetes, please work yourself. So that it goes to not diabetic level. So if in this case, doctor, if the patient is going to be diabetic patient, we are going to start the patient on medication. Most common one is metformin.
Yes, correct. First line.
But nowadays we have so many other medications. So what would you say about it?
Okay, this is my personal opinion. Yeah, not. I'm saying this is the right way. No, this is what I do. This is my personal opinion. Whenever a patient comes to you, to me, right? Number one, you're supposed to say newly diagnosed atau memang dah pernah ada kecil manis. That plays a very big role.
Yes, so we will have an idea. Okay, this patient is newly diagnosed.
Yes,
okay.
Can start ke, tak start ke. Number two is that the patient itself. Younger patients have higher semangat sikit. They want to reverse it. Older patients, they just, you know what, never mind, I'll just take medications. Number three is the lifestyle of the patient. How is their work, sedentary lifestyle? They work office a long time. You know, sometimes you do need an additional push. So when you have that additional push, we need to start on medication. And fourthly, I always look at is BMI. Not body shaming lah, but always look at BMI. If the patient is a little bit on the bigger side, I would always start them on medication.
Okay.
Why? Because once the higher the BMI, the insulin resistance, for you to actually bring it down, it's even more difficult.
Yes.
Yeah. Like I said, diabetic is actually a metabolic disease. Kenapa? Sebab your metabolism is not working well. So macam mana kita nak naikkan metabolism? Cardio. You naikkan your heart rate and then come down, heart rate. You know, when you naikkan, come down. When all this happen, that's when your metabolism actually goes up. But a person which is in a bigger side and a person who is so used to sedentary lifestyle, I tak boleh cakap, terus pergi lari 40 minit, terus pergi swimming 40 minit. You know, they won't be able to do it. You always have to start slow. Why I always start them on medication is that because, together with medication and lifestyle modification, so that they don't lose hope. Sometimes you put in all your effort, but you don't see the scale moving.
Yes.
Yeah.
You become very frustrated.
Yeah, you become very frustrated. End up what happened? They give up. They give up. Tak nak lah, I buat apa pun tak ada guna. So tak payahlah nak buat. Might as well I just enjoy my life. You know. And there'll be a rebound. Even they lose, not up to their expectations, they stop, there will be rebound weight gain.
Yes.
Of course now, the most common one is Ozempic.
Yes, it's very it's quite
yeah.
Very
Ozempic, GLP-1 lah. Any kind of GLP-1 receptors. Metformin is the basic, obviously. I would always start a patient on metformin, provided the renal functions is all okay and they're okay. But like I said, I will always keep track 3 monthly to make sure there is a changes. If the patient is keen, then start them on Ozempic, GLP-1. Of course, not in a long term not long term, but you can see difference in your insulin spike, in your HbA1c, and also in your weight gain. You will have that weight. Tapi like I said, kena add dengan lifestyle modification. You cannot completely depend on medicines only. And I always say, don't have to take any fancy supplements. You, like I said tadi lah, makanan ciptaan Tuhan and ciptaan manusia. Yeah.
Okay. So doctor, like just now we have already spoke about diagnosis, we already spoke about medication. So like most of us knows that if you come to a certain level, yes, we can stop your medication. Okay. Can we talk about stopping the medication? Because most of the time the concept that we have is the moment you are diagnosed with diabetes, you have to eat your medication until
lifelong. Yes.
But actually it's not really true.
Correct. Like I said just now, it is reversible.
Yes.
Type 2 is always reversible. And when you reverse it, you stop the medication, you continue your lifestyle, but kena
ada
annually take your blood test. Yes.
Follow up and then continue your follow up lah.
Yes.
So yang biasanya this kind of patient, like it is easier to achieve when you have you can really modify your lifestyle.
Yes, that's number one. One more thing that I frequently is they will always have a rebound. They will semangat diorang buat. Lepas tu HbA1c normal, okay kita tutup ubat lah. For 1 year they'll be okay, discipline. Then the next year naik balik. They always yo-yo. For patients like this that yo-yo, you want to give just as a prophylaxis, just a maintenance dose of medications, it is possible depending on the patient itself. If they feel like, no doctor, I still need extra push or what, then yeah. Bila semangat tu kena selama-lamanya lah. Janganlah selalu semangat kejap aja, right? You know. So that is another factor actually. It all goes back to the patient, goes back to the people, goes back to your own personal preference.
So if like in this case scenario lah, doctor, so what would you suggest? So if a patient who comes in who has a very strong semangat lah, semangat very strong, that they can show that their fasting blood sugar is really good, their HbA1c is really good, and they don't have any symptoms and all, so we would stop them.
Medication.
Stop their medication, right? So how would you tell them come back when do you follow up with them?
Okay, first 1 year baru diagnose, baru turun 6 monthly.
Okay.
6 monthly times 2.
Okay. So every 6 months they have to take the blood also.
Correct. HbA1c for 2 times. Normal, and then annually.
Okay.
Don't have to poke them so often lah. As long as, because the HbA1c is usually the 3 monthly punya kan.
Yes.
Some places they do 3 monthly. 3 monthly, 3 monthly, 6 monthly, 6 monthly, and then 1 year.
Okay.
Usually if the first HbA1c is okay, I give them a little bit time lah. Bagilah kesian sikit kan. See you betul-betul disiplin ke tak. So 6 monthly, and then annually should be fine.
Okay. So is it possible?
Yeah. It is possible. Lately, I do notice a lot of them with the changes and all. And of course, they come in with, they also feel like personally, sugar actually, when you have less sugar, not only in the entire thing, even in your mental health, they say they have lesser anxiety. Your skin, you won't have so much of acne, it clears up. You feel even more hydrated, lesser fogging, better sleep. It helps you in a lot of ways. So once you dah rasa your buah from all the things that you're doing, right? Of course, you would want it lifelong. And you make it a habit, you make it a lifestyle.
Okay. Yes, actually it really happens.
Yeah.
Because I usually get a lot of patients with that kind of
correct.
Tapi saya dah tak rasa anxiety sangat lah. I don't feel the
skin is nicer, hair is nicer.
Skin is nicer, and I don't have the mental block as much.
Correct.
I feel very much. I absorb things better. So I'll be like, okay, because you are healthier now.
Correct.
You're healthier. Your sugar is very controlled. Your BP is very controlled. Most of the time they'll have all the 3 problems: diabetes, kencing manis.
3 serangkai.
Cholesterol and tekanan dalam tinggi.
Even you see, the most common one is always high LDL. They always come in with that first.
Yes.
Which eventually, will cause everything
Everything
other
else.
symptoms lah.
Okay.
Anything also, your exercise, like lifestyle 70% is your nutrition, whatever you're putting in your body, and 30% your exercise. So you eat all the sampah-sampah, and then you go and exercise. There's no point. It's always whatever you're putting in your body first, and then only 30% contributes to your exercise. Yeah.
So we can actually think about before eating. Got man-made or
man-made or God-made, yes.
So doctor, for the last question,
Okay.
anything you would like to say to everyone for who has diabetes?
Okay. So diabetic ni sebenarnya is not the end of the world lah.
Yes. The moment you say, okay, kencing manis tinggi sikit,
Yes.
tinggi sikit, dia bilang,
Yeah, they always think of the complication.
Yes.
Okay, complication-wise for diabetic,
Yes.
there is three classifications.
Yes.
Number 1, neuropathy. All your kebas-kebas tangan, kebas kaki, kebas-kebas merah everywhere. Number 2, retinopathy.
your eyes.
Yeah, blurring of vision, glaucoma, your this one and all. And number 3 is nephropathy. Gagal buah pinggang, sakit jantung, stroke. All this will happen. These are the main common complications.
Yes.
So when you tell them that they have diabetic, immediately they'll think of all this.
Because it's like everyone talks about it.
Yeah.
Kalau ada kencing manis, buah pinggang akan gagal. Kalau buah pinggang gagal, kena buat dialysis.
Dialysis terus.
So it's like they have that thing in their
The
mindset.
mentality, yes.
It's like it's scaring them.
Correct. And they come in with the perception that kalau kena diabetes kena makan ubat sampai mati. So they get very heartbroken, they get very like stressed, especially when you are very young and you come in with all the symptoms and all the things and issues, right? So I think as a doctor, our main duty is to tell them that no, there's no such thing. Boleh je reversible, jangan risau. One more most important thing I've been noticing, a lot of couples yang trying to conceive, TTC couples kan, they will come in. And then, when they're trying to conceive and they want to do a medical checkup, most of their HbA1c will also be on a higher side. So I would also tell them, see, this is the main cause actually. So why don't you reduce your HbA1c? You see any success ke tak, in trying to conceive and all these things. These are like it's like a very, like I said, it's an epidemic, global epidemic sebenarnya, but it has been there for a very long time actually. So it's not the end of the world. Boleh reverse, it can reverse with proper lifestyle modification and all that. Not only diabetes, any other cholesterol ke, hypertension ke, anything else also. Sugar, they said too much of sugar in the brain for kids will cause ADHD.
Yes.
Too much of sugar in adults will cause dementia. Too much of sugar in the bloodstream, cause diabetic and acne and all these things. So the culprit is not necessarily, I mean, sugar, yes, but not necessarily that. Carbohydrates, complex carbs, anything in moderation.
Yes, you can still eat.
Yes.
But just eat in moderation.
Correct. Boleh je makan coklat, boleh je minum air manis, tapi janganlah banyak sangat. Kan sikit-sikit.
Boleh rasa.
Yes. They come in, stop rice, stop minuman manis.
Yeah, because I think the moment you start overdoing it, like, okay, kerja manis, diagnose already, the moment, okay, saya tak nak makan nasi, saya tak nak makan.
That's the first thing they cut.
Tak nak sugar, tak nak ni, tak nak.
Lepas tu hypo, lepas tu
So it's like, it lasts for about 2 months.
Correct. 2 months is already very long.
And then it's like, tak boleh lah doktor. Saya rasa penat.
Pening, penat. I nak makan ubat je lah.
Actually, that is there. So I always tell them, no, you can eat rice, but eat in moderation. Boleh je makan nasi, tapi makanlah sikit.
Like KKM, they introduce suku-suku separuh, you see? That's a very good initiative.
Yes. So I always tell them, okay, boleh je makan. If you want, you can go and you take your weight and then you get your calorie. You need to eat how much of
calorie deficit, yes.
But calorie deficit too. So that from there you know how much of protein you're supposed to take, how much of fiber you're supposed to take, how much of carbs you're supposed to take.
Yes.
Fats you have to take.
Very good additional, I want to say supplement lah, additional thing that you can add into your daily meal. Not necessarily if you're diabetic, even as a normal patient, I would highly encourage anyone to start on ACV, apple cider vinegar. Apple cider vinegar, yeah. If you are a little bit scared as a start off, you can just take 1 tablespoon. 1 tablespoon in 100 ml of water lah, half cup of glass. Drink with straw. Jangan minum macam tu because it will corrode your gigi.
Yes.
Yeah. Take it at least 10 to 15 minutes before your every meal.
Okay.
ACV reduces your insulin spike. It helps to burn fat. It reduces your insulin spike, retains longer. That's why I start with 1 first. Of course, the recommended dose is 3 tablespoons. So don't immediately start with 3. Start with 1. Start slowly. Don't have to start in the morning. We would advise to take early in the morning when you're fasting, right? Why don't you start before lunch first?
Okay.
Start slowly.
So 1 tablespoon with 1 cup of water.
1 cup of water, half cup of 100 ml lah. Half cup of water. It helps when it goes into your system, right? It reduces the sugar spike. So whenever you eat, it don't have too much of spike. That way, lepas makan lunch, you won't feel sleepy. You won't feel tired.
Okay.
It helps the symptoms. So that is something which I would highly encourage any of my patients.
I've read about it. Ada banyak research.
Yeah. There are plenty.
Plenty of research.
Yes.
But I've not actually tried it because I have gastric problems.
I see. There is 2 types. There is one just ACV by itself, and there's one more ACV with mother. Mother is a live bacterium, which is also a kind of probiotics.
Yes.
You can see that it's written with mother, macam with ibu lah, with mother. Yeah, that is amazing. I would highly encourage. Don't go for gummies. Gummies is high sugar.
Yes.
ACV gummies, right? Don't go for gummies. Don't go for tablet. Don't go for. I know nowadays they got lots of soft gels also.
Yes,
Don't need. Go for the authentic one, and then just try it for a week or 2. You can see ample of difference in your energy wise. Just a little bit first, and then you can taper up your dose.
So the maximum dose is 3 tablespoons.
3 tablespoons. Yeah.
Okay. I think it's interesting. Okay, anything else would you
No,
like?
that will be it.
Okay, thank you so much, Doctor, for
Thank you.
joining us today.
Sure. Thank you.
Thank you so much.